massive changes to Plan B COVID rules in England announced by the Prime Minister, including that secondary school students will no longer have to wear face masks in the classroom from today.
It's also expected the legal requirement to self-isolate when you test positive may be removed completely by March, if not sooner, and that will be replaced with advice and guidance. The Health Secretary, Sajid Javid, joins us now. Very good morning to you.
Good morning.
I want to ask you first, Sajid Javid, because we've just been discussing it on the programme, and Dr Hillary has suggested, along with the Royal College of Nursing and Midwives, that the vaccine mandate for NHS staff should now either be delayed or scrapped altogether, that the biggest threat now to the NHS would be the imminent loss of tens of thousands of staff because they won't or can't get vaccinated. We heard Dr Steve James. You had a confrontation with him a couple of weeks ago. He refuses to get vaccinated. Just have a listen to what he said.
The point is made that I should have this vaccine because I've had other vaccines before. Then you have to see the differences. And I'm willing to work away from my job, as are the vast majority of people who've contacted me.
Can we afford to lose 80,000 members of NHS staff right now?
Look, I don't want to lose a single health worker. And with respect to the clip that you've just shown, that we live in a vibrant democracy. Everyone is entitled to their opinions, but everyone is not entitled to their own facts. And the fact is that vaccines limit transmission. And when you go to hospital, you're already there because you're ill, you're very, very ill. You don't go into hospital to get worse, you go into hospital to get better. And I think it is the professional duty of all health workers, especially the frontline health workers, to do everything they can to limit transmission of a disease that could make you much worse.
If restrictions are lifting so significantly, and you're talking about reducing isolation potentially from the end towards the end of March, scrapping it. So if they're lifting so significantly, would now be the right time to be looking at this and considering actually whether that vaccine mandate has to carry on for NHS workers? Because I'm sure you don't, as you pointed out, you don't want to lose Dr Steve James and the other 52,000 NHS workers that are choosing not to have the vaccine.
The General Medical Council, that's the regulator for all doctors, including Dr James, it already requires, long before anyone had heard of COVID, doctors to be inoculated, to be vaccinated against a variety of diseases. I think some 7 or 8 diseases, things like hepatitis B, tetanus. Now, we don't have rules, like COVID-type rules against those diseases, but doctors still vaccinate themselves against it. And one of the reasons they do that, in fact, the main reason they do that, is to limit the risk of transmission to people who are already very vulnerable. That's why they're in hospital.
So you won't be looking at lifting this mandate then? Regardless of the easing and scrapping of restrictions, this is going to stay in place. It's no jab, no job.
This mandate plays an important role. And can I just say this, that I would just say to you or your viewers, imagine one of your loved ones went to hospital for something other than COVID, and they ended up catching COVID from a member of staff where it could have been limited, that risk could have been limited, and they end up dying from that. What would you be saying to me then on your programme? And it is not right that someone who's working in healthcare, or care homes for that matter, is not doing all they can to limit transmission when it could impact vulnerable people in this way.
Yeah, and we know how important vaccines are, but we also know how important NHS staff are. So just to establish, people need to have got their first vaccine, I think, at the beginning of February if they're going to get in under the wire and not lose their job at the beginning of April. So just to establish, as the Health Secretary, you are not considering delaying that deadline that is fixed in stone?
We're continuing with the plan that had overwhelming support, by the way, in Parliament, across the House, because MPs want to make sure that their patients, that their constituents, when they are patients in hospitals, are as safe as possible.
And how are we going to fill those posts?
Well, we've already done something very similar with residential care homes. So that law has already come into place and that deadline has already passed. And I'll tell you this, that when we planned that at this stage, there were a number of people coming out with all sorts of stories around there'll be tens of thousands that will leave care homes. They will never get vaccinated. Our care homes will be closing. And I can tell you that not a single care home that we're aware of has closed because of the vaccine mandate, but as a result of it, they are all safer. And I think what will happen, and we'll continue to see happen over the coming weeks, is that more and more of the NHS staff, now remember 94.5% have already had a vaccine, but those that haven't will continue to come forward and make that positive decision.
Can we talk about the lifting, excuse me, of restrictions? Dr. Hillary was in the studio this morning. He has huge concerns about the lifting of the restrictions and the speed that they are happening. As he pointed out, there's 20,000 people with COVID in hospital at the moment, 80,000 cases, 750 are on ventilators. The R rate is still at 1.1 to 1.5. Lots of our viewers getting in touch today. Peter has got in touch to say Boris Johnson's throwing us to the wolves to save his job. People are going to die. He doesn't care. It's all about saving his job. Can you reassure everybody that this isn't a political move? Boris Johnson, with his concerns about where his position and his authority within the party and in the country, struggling as it is right now, isn't doing this just to try and distract everybody. And this is the right time, with there's so much pressure on the NHS, to be lessening these restrictions.
Yes, of course, I can reassure your viewers of that. This decision is based on the very latest data. Of course, we've been monitoring that probably hour by hour, not just day by day, and it's based on the advice of our clinical advisors, some of the best in the world. And what they have seen in the data, thankfully, is that we are starting to turn the situation around as a country. Our advisors believe that we've reached the peak of case numbers. We've reached the peak of hospitalizations. Hospitalizations in some parts of the country, they are falling. In other parts, they have stabilized, so they're certainly not rising. And, of course, that is good. There's still, it's fair to say, there's still a lot of pressure on hospitals, and the NHS workers are still working incredibly hard, doing a fantastic job. But we've always said that these restrictions should only be in place for as long as absolutely necessary, because they have a big impact on the rest of society. I mentioned some of those bigger impacts yesterday, whether it's on people's mental health, the life chances of young people, the education of children. And so we always need to take a balanced and proportionate approach.
Yeah, we would hope this was being done for purely health reasons. But as Ben suggested, there are a lot of your critics who say this has been done at a very convenient time. Prime Minister's questions yesterday, we saw a Conservative MP leave the Conservative Party because of his frustration and disillusionment and join the Labour benches. But maybe more significantly than that, we saw a former Cabinet Minister, the former Brexit Secretary, David Davis, say directly to the Prime Minister in public, in the name of God, go. That's a terrible thing for the Prime Minister to hear, isn't it?
Yes, it is. Of course it is. No Prime Minister wants to hear that from any of his own party, and no one wants to see a defection. But these things happen. It's not the first time it's happened in Parliament. It won't be the last. But it was sad, I think, to see Christian Wakeford, that's the MP for Bury South, to defect. And I wish him the best, but he's made a decision. I think it's the wrong decision. And when it comes to David Davis, I think the senior member of Parliament that you refer to, I have a lot of respect for him. I don't agree with him on what he said. And on this whole issue, obviously David Davis is angry, Christian Wakeford is angry, I'm angry, and Payne, your viewers are millions of people about what they've seen and what they've heard, and they're right to be, of course they are, and that's why it's also right the Prime Minister has come to Parliament, he's apologised, but he's also asked for the time and space for the investigation that's taking place to be completed, so the facts can be established.
Are you getting tired of having to come on a show like this morning and defend the Prime Minister?
I'm not getting tired of doing my job, which I think is a pretty important job.
But your job, yeah, you have a hugely important job. But is it your job to be defending the Prime Minister when we hear him being interviewed and he says, "No one told me it was against the rules"?
Look, my job is hugely important, as you say, and I'm getting on with that. I'm also there rightly. I support this government and everything that we are delivering on, whether that's getting Brexit done, it's supporting the economy and creating jobs. I want to play my role in that. I support our Prime Minister, and I accept his call to give the time and space for this investigation to be done. And when it is done and the facts are established, he will come rightly, as he said, he will come to Parliament. He he will take full responsibility and he will subject himself to scrutiny by all MPs in all parties. And I think that will be the right way forward.
Sajid Javid, thanks for joining us this morning.
Thank you so much.